Finally, from us this evening, the American Agenda. Tonight we're going to look at medicine and technology in the operating room. Doctors know that the more cutting and exploring they must do during an operation, the more danger there is for the patient. But now an emerging technology is letting them do a great deal of their exploring before ever touching a scalpel. Our Agenda reporter is Tim Johnson.
7 o'clock tomorrow morning?
Tomorrow morning, most likely. I'm going to have to come in a little bit earlier.
For years, Alexandros Sideropoulos, a 41-year-old baker, restaurateur, and father of 4, began each busy day at 4:30 in the morning, until last spring when he was diagnosed with a brain tumor.
How big do you think it is, Lang?
It's about 3 centimeters.
That tumor brought Alexandros to Boston's Brigham and Women's Hospital, where enhanced imaging techniques are revolutionizing the look of surgery.
I think the tumor is now anatomically matched, but the question
Here,
is,
with near X-ray vision, neurosurgeons can now see through a non-transparent surface, the skull, and assess what lies beneath.
You can peel away the surface of the brain. You can get at the actual core of what you're trying to reach, and it's a very sobering kind of thing for a doctor to be able to do.
As we cut away the scalp, you see the tumor is segmented in green. And
the preparation for surgery begins in the planning lab, where doctors, using Alexandros' MRI pictures, reconstruct a computerized anatomical model of his brain.
We'd make an incision like this, and then we should be able to see the tumor I would expect.
This interaction maximizes the ability to locate the tumor, analyze its size, and plan a surgical strategy that will minimize the risk.
we're just making a few adjustments here, Mr. Sideropoulos. Everything's going okay.
Then, with the use of laser technology, the computer model of Alexandros' brain is placed over live video of his head.
All right, I'm just going to start making the marks now, Mr. Sideropoulos.
Those two images, exactly lined up and superimposed, become a map for Dr. Langham Gleason to trace the outline of the tumor onto the shaven head of Alexandros.
so that the surgeon can see specifically where the tumor is and can plan to make an opening that's adequate to expose the whole tumor but minimizes the risk to adjacent brain.
Can you wide angle the camera a bit, Sandy?
Final adjustments are made in the operating room before the first incision is made.
Could I have a knife, please?
Yeah.
Sometimes you're a little awestruck by the ability to look at this kind of power and to use it in the day-to-day care of patients.
And we see tumor here, Langham. We're right at the edge of the tumor. This is perfect. Your estimation was just perfect.
2 hours after the surgery began, the surgical team removes a 3-centimeter non-malignant tumor from Alexandros' brain.
It's a very powerful potential technology.
And it's just the beginning.
I think that we will get better and better at destroying the tissue we want without opening the skull at all.
It is this vision of minimally invasive procedures that drives the research team here at Brigham and Women's Hospital. They are perfecting image-enhancing technology that will change the face of surgery as we enter the next century.
Again, take in a breath and hold your breath.
Already, the Brigham has developed technology like this, the world's first and only intraoperative MRI.
Sir, could you take in another half breath for me?
The standard MRI uses a magnet to generate images of human tissue for later use. This new unit splits the magnet, allowing the surgeon to work as the images are being generated, providing greater precision and accessibility.
Take another breath in for me, just a half breath.
Dr. Stuart Silverman can see the images of his patient's liver on a display in front of him in multiple planes and angles.
That's it, perfect.
Today, he performs a liver biopsy. But researchers are also refining techniques that will allow more complicated surgical procedures in the future.
You're doing wonderful.
Procedures that will be done with less tissue destruction and less cutting. Image-enhanced surgery is already proving useful.
Protect the bone with your body.
The technology is helping patients like Alexandros, who was back home with his family 48 hours after his surgery.
Oh, that was good.
Within 1 month, he had resumed both his full work schedule and his active life with his children. This is Dr. Timothy Johnson for the American Agenda.
And that is our report on World News Tonight. Later on Nightline, Ted Koppel. I'm Peter Jennings. Have a nice evening. We'll see you tomorrow. Good night.